I thank the distinguished presiding officer, and I'm going to speak for just a few minutes about H.J. Res. 43. I see this as a misguided, unfortunate attack on health care for women. And certainly that's what I'm hearing from women in the state of Vermont. 3 months into 115th Congress, the United States Senate is yet to consider real legislation aimed at addressing the many challenges that we Americans face today. Instead, the Senate is, with simple majority votes, permissible through the rarely used Congressional Review Act, is rolling back key protections for the American people that were put in place by the last administration. Now, never mind the current administration has the power to address certain aspects of regulations that they wish to rewrite. No, they could address these. They could seek a rewriting of them. They could seek legislation. But instead, Republicans in Congress are intent on using this blunt procedure to unravel years of very careful and deliberative work. And these raw power plays are part of the Trump Republican know-nothing anti-science agenda, in which the winners are not the American people. They're not the women of my state. They're not the average person you might meet. Instead, they're typically the wealthy and powerful special interests and big polluters. They win. The losers are real Americans. Today, we're considering the 12th such resolution, one that rolls back protections under the Title X program. Title X of the Public Health Service Act is the only federal grant program dedicated to providing those eligible with comprehensive family planning and preventative health services. In rural areas, and every single state has a rural area, but my state is especially rural. In Vermont, we know that Title X is crucial in making sure that the women of Vermont have access to the basic health care they need. But unfortunately, in recent years, some states have made exceptions about which providers may deliver services under Title X, and they've excluded clinics that may have family planning. Seeing the burden these rules would place on women seeking health care, the Obama administration finalized a regulation in December 2016 that protects these providers from this type of discrimination and women from these hardships. The resolution we are considering today would undo this regulation. Once again, it would allow states to discriminate against providers. Thereby, they'll be limiting access to health care services for millions, and that's not hyperbole, it really is millions, of women and their families. Worse still, the resolution would prevent any similar rule or regulation being implemented in the future. Now, in Vermont, our sole Title X provider is Planned Parenthood. Even as in a state as rural as Vermont, no one has to drive longer than 45 minutes to reach a clinic. That's important to us. I mean, we consider 4 to 5 inches of snow a heavy dusting, but we often have 10 to 15 inches of snow. And nobody should have to drive 45 minutes to reach further than that, to reach health care. This type of access is critical for those who need these services. It's especially important because for 40% of women, their visit to a family planning health center is the only health care they receive during the year. Vermonters are lucky because our state recognizes this issue isn't about abortion, it's about ensuring the best network of providers for the people of our state. There are a lot of health issues they face, but other states have already worked to undermine family planning clinics like Planned Parenthood. And passage of this resolution will allow these discriminatory efforts to advance, especially discriminatory against women. There's no question about it. A vote for this is a vote against women. The resolution would affect the lives of millions of American women, but also affect the lives of men and young people who trust and depend on family planning clinics for their basic health care needs, including for annual health exams, cervical and breast cancer screenings, HIV screenings. Last year in Vermont, and keep in mind, Vermont has a population of just over 600,000 people. Planned Parenthood centers provided vital, primary, and preventive services to more than 16,000 patients. So, a small state like Vermont, if you vote for this resolution, think what you're doing to hurt these people. Now, those who support the resolution argue the state should be able to determine who receives Title X grants, and the women under the program can simply, find another clinic to go to. Well, that's not the case. In fact, that argument is false. It's a lie. Family planning clinics overwhelmingly serve populations in rural and medically underserved parts of the country, where access to health care, especially for low-income individuals, is difficult. Easy for senators to vote to cut off this health care for women and children, people in rural areas, because each one of us, if we need health care, can walk 2 minutes down this hall and walk into the Capitol physician and say, I'm a United States Senator. I need health care, and you're going to get it. Well, that may be the reality for 100 people in this body. It's not the reality for millions and millions of people in every single state we represent. What this partisan resolution would do is force women and family in states who depend on family planning clinics for their health care to find another doctor, and often very few are available, or what's more likely, go without care at all. So they don't get preventive care. They don't get the checkups. They don't find the first indication that they may be facing melanoma or some other serious health problem. And that undermines all of our efforts, which we should be joining on, to strengthen our nation's health care system, to try and make our health care system at least as good as many other countries, and to ensure access to care for everyone. But this Republican resolution marks just the latest overreach and intrusion into women's health care. They even voted for a resolution that would allow people to spy on what you do in the network, on your internet, and then sell that information for their own profit, destroying your privacy but making money doing it. Now, until the House failed to even take it up, the Senate was scheduled to consider a reconciliation bill this week that would have defunded Planned Parenthood. It would have allowed health insurers to deny coverage for maternity care, thus requiring women to pay more for health insurance. The last Congress is more of the same. Deny coverage for maternity care. And then they'll go out and say, we believe in a right to life. Not so much for the mother, or to take care of her when she needs the maternity care. Should we really walk back from the remarkable progress we've made as a nation in women's health? Of course not. But I'm concerned we still see the same irresponsible attacks surfacing again and again. Look, it's 2017. It's not 1917. It is time for the mean-spirited and ideological assaults on women's health care to end. Women are not second-class citizens. My wife is not. My daughter is not. My 3 granddaughters are not. They deserve the same access to care as men. And I urge senators to vote against this resolution that will degrade the health care and access to health care of so many Americans. Mr. President, I suggest you have the quorum, and if I suggest you have
The clerk will call the roll.